This is a variation of a biceps curl using an easy bar. The advantage of this bar allows for different hand orientation as shown. The current semi-pronated hand position allows for more utilization of the pronator teres compared to a standard neutral grip. The agonist in this exercise is the brachialis muscle. The brachialis originates in the distal half of the anterior humerus. Its insertion is to the coronoid tuberosity of the ulna. Its action is elbow flexion, and it's the strongest flexor of the elbow. It's innervated by C5 and C6 musculocutaneous nerve and the radial nerve. And lastly, its blood supply is muscular branches of the brachial artery and the recurrent radial artery. This variation of the bicep curl is done to allow for concentration of the brachialis muscle. By resting your arm on the elbow pad, it eliminates the use of momentum by swinging the weight upwards. The agonist in this exercise is the biceps brachii. The biceps brachii has two heads. The long head originates at the supraglenoid tubercle on the scapula, and the short head originates at the coracoid process of the scapula as well. Both of the heads insert to the radial tuberosity. The long head's action is abduction and internal rotation, whereas the short head's action is adduction, flexion of the forearm, mainly in supination, and slight flexion of the arm at the shoulder. It's innervated by C5 and C6 musculocutaneous nerve, and its blood supply is muscular branches of the brachial artery. This exercise focuses on targeting all parts of the triceps. The long head, lateral head, and medial head all activate to move the weight in a vertical direction, as well as to limit the side-to-side movement of the weight. The agonist in this exercise is the triceps brachii. The triceps brachii, as stated previously, has three heads. The long head originates at the infraglenoid tubercle of the scapula. The medial head originates in the dorsal humerus, and the lateral head originates in the dorsal humerus proximal to the radial sulcus. They insert at the olecranon of the ulna and capsule of the elbow joint and the antebrachial fascia. The action of the triceps brachii is elbow joint extension. It's innervated by the radial nerve, and its blood supply is muscular branches, superior ulnar collateral, and profunda brachii arteries from the brachial artery. This next exercise is known as a dip. Dips are a classic exercise for the triceps brachii. The pectoralis major and deltoid are synergists in this exercise. Depending on the angle of the trunk, some muscles can be targeted more than others. The agonist in this muscle, again, is the triceps brachii. And the origin, insertion, action, innervation, and blood supply are the same for overhead tricep extensions. This next exercise is known as a leg press. During the downward motion of a leg press, the anterior muscles of the thigh are concentrically contracting, whereas the posterior muscles of the thigh are eccentrically contracting. The roles of the muscles of the upper leg are reversed during the upward motion of a leg press. The agonist in this exercise is the rectus femoris. The rectus femoris has two heads. The straight head originates on the anterior iliac inferior spine, and the reflected head originates on the acetabulum. The rectus femoris inserts at the base of the patella. Its action is flexion of the hip joint and knee extension. It's innervated by the femoral nerve, and its blood supply is the descending branch of the lateral femoral circumflex artery. This next exercise is known as a lying hamstring curl. Lying hamstring curls allow the weightlifter to focus on activating the biceps femoris by resting their weight on a bench to only allow for knee flexion. This action is done with assistance from the gracilis muscle, the semitendinosus, and the semimembranosus muscles. The agonist in this exercise is the biceps femoris. The biceps femoris has two heads. The long head originates at the ischial tuberosity, and the short head originates at the lateral aspect of the linea aspera. The biceps femoris inserts at the head of the fibula. Its action is flexion of the knee, rotation of the lower leg under full extension. It's innervated by the tibial portion of the sciatic nerve, which is L1 and S1, which innervates the long head, and the short head is innervated by the common fibular portion of the sciatic nerve, which is L5 and S1. Its blood supply is the perforating branches of the popliteal artery. The next exercise is known as a seated calf raise. During a seated calf raise, possible use of upper body momentum is eliminated. The gastrocnemius is the prime mover of this exercise, with muscles of the upper leg and anterior lower leg as synergists. The agonist in this exercise is the gastrocnemius. The gastrocnemius has two heads. The lateral head originates in the posterior aspect of the lateral condyle of the femur, and the medial head originates in the posterior aspect of the medial condyle of the femur. Its insertion is the calcaneus. Its action is plantar flexion of the foot. It's innervated by the tibial nerve, which is S1 and S2, and its blood supply is the popliteal artery. The last exercise is known as a donkey calf raise. Donkey calf raises are an exercise where the gastrocnemius is the prime mover with assistance from the soleus muscle. This exercise focuses on the upper portion of the calf muscle. The agonist in this exercise is the gastrocnemius. The gastrocnemius has two heads. The lateral head originates in the posterior aspect of the lateral condyle of the femur, and the medial head originates in the posterior aspect of the medial condyle of the femur. Its insertion is into the calcaneus. Its action is plantar flexion of the foot. It's innervated by the tibial nerve, which is S1 and S2, and its blood supply is the popliteal artery.